Hey there, Dr. Freeborn Mondello here. I'm here today to go over what a proper physical therapy evaluation or assessment should look and sound like. I want to cover the key points of what you should be expecting if you're seeing a good rehab or performance practitioner. That's typically going to be a physical therapist. In some cases, I suppose it could be a chiropractor. There's some newer, younger chiropractors engaging in real rehab. Most likely, though, the model is that you'll go see a physical therapist. You should have a session one evaluation, whether that's in person or virtual. And also, I know there's some questions about, well, how can a virtual physical therapist assess what's going on with me? And so I want to cover those points. I want to cover the key pieces of what that physical therapy evaluation should look like, what the outcome should be, and what the next step should be. If your physical therapy evaluation does not look very much like this and does not hit all of these points, then you're probably seeing the wrong physical therapist. Maybe it's not even their fault. Maybe they're just a part of your typical healthcare system at this point, too busy, too overworked. They can't actually cover all of the bases in a session. They've got the next one and the next one and the next one, and they're trying to keep up. Hey, that's fine. Let's not blame the PT in that situation, I suppose. But I will just tell you, as the client, you as the person in pain and looking for the best outcome for your time, your money, your work, and your life experience, that it's time for you then to go ahead and engage a new physical therapist, a new trainer, a new performance expert who can guide you through this process. So, number one, hopefully you can see that on the board, just PT evaluation. What are we looking for? So, we're looking for three things during that PT evaluation. There should be a history, there should be a movement assessment of some sort, and there should be, as we've learned, special tests, which are not so special. Truly, I'm not just saying that because I'm here on a virtual video. Those not so special tests we'll talk about as we get to them. So, number one, the number one most important part of a PT evaluation, and this is a mindset change for clients that walk into an office of a good PT, because here's the thing, the number one thing that should happen is a conversation, a long, in depth conversation, and it should be about you. It should be about who you are, where you've come from, what your problem is, when did it start, how did it start, what came before that, what's your history of training, what does your life look like, what are your health practices, do you have any health practices, what does your work life look like, what does your home life look like, what are your stressors, how's your nutrition. This is the most important part of a PT evaluation. This is what we call the history. The history is the conversation. In my practice, we could spend almost all of our time, or even all of our time together in that first session, taking a history, because the history is what will lead us to understand why you have a problem, what that problem is, and how do we get you out of it, and can we get you out of it, and what is the goal, and is it realistic? You come in with an ankle sprain, you claim you just got last week on a trail run, but as we keep going, we learn you've had a history of ankle sprains, you've never strengthened it, you've never completely rehabbed it, you've got a race next week. Well, now we know that's a different picture than the person who's been checking all the boxes of health, nutrition, stress, strengthening, and just got their first ankle sprain and understands they want to rehab it. But one of you, we may be able to be on a 4-week timeline to get you back to training at full blast, and the other one we may realize you were never even ready for the training that caused this ankle sprain. That's why you've gotten the ankle sprain. And now we've got 6 months of work both to prepare your body to do what you want it to do and to heal this ankle sprain that was caused before because you had poor training principles and a poor plan and you were unprepared. Um, so many other examples, but it all comes down to that history. That history is everything. More often than not, we can have a conversation and I can label your problem. You can describe the symptoms, when it happened, how long it's been present. We can describe the severity going up and down, improving or worsening. And that conversation can allow me to say, oh, you've got a meniscus tear. We don't need to almost ever even get to these special tests in that case, because the special tests aren't going to tell us anything we don't already know. That brings up another subject of MRIs and imaging. We'll talk about in a separate video, but it's the same thing. Like, if I know you have a meniscus tear, now we can have the conversation about, is it worth doing the conservative approach? Will PT get me to my goals if I have a meniscus tear? If I'm a 40-year-old half marathon runner and I want to run a couple races this summer, should I just go get the surgery, or should I engage with you in a physical therapy program? I want to be able to run and I want to be able to play with my kids. Well, first off, the answer is yes, you should do physical therapy. The surgery is not the right choice in that scenario. And in many scenarios, it's not. But what we know is if you go get the imaging, it's a little side note, but it falls right in that special test category. If you go get the imaging, we're going to see things wrong, and the medical system is going to diagnose you and then take you down this medical pathway. And the medical pathway, more often than not, is going to end up in an orthopedic surgery. There may be a time and a place where you need surgery. I will admit that. However, we are going to do everything in our power to keep you out of that surgery and healthy with what we call a conservative approach for as long as we possibly can. So all of that comes from the history. Also, we need to learn your values. I need to understand who you are, and am I really the right person to help you? You may tell me during that history conversation that you've never worked out before. Fine. You will never work out. You refuse to engage in any kind of movement practice. If you tell me that, I'm going to say, well, I'm sorry to hear that. I think that's the wrong choice if you want to be healthy and happy long term. But if that's your value system and you don't want to ever exercise and you don't ever want to learn how to move better, and you're too busy and you don't have any weights, or you can't find a weight, or you can't buy a weight or go to the gym, then I'm not the guy for you, because my goal is going to be to get you moving properly, to progress that, and to add load and to reset, reinforce, reload, get you strong over time. And that's the only way I know how to help you. We're going to talk about nutrition and daily activity and work and stress and all the rest of the things that contribute to a healthy, pain-free life. But it's going to be foundational. The bottom of that pyramid is, let's get you moving better and let's get you stronger. All of that should and could come up in any good history session with any PT. You may find your PT only loves to prescribe yoga or Pilates type movements for their rehab programming. That could work. You could hate yoga and Pilates. I don't know. I don't know you yet until we've talked and had that history conversation. But the point is, that is the most important part of your conversation. So if you go to an evaluation with a PT, don't get frustrated that they're just sitting there talking to you. That should be the key to that whole session. If they never even get to the movement assessment, I would rather that happen. Then they jump in, they assess your movement, they run you through some tests, and then they tell you what's going to happen next. That is a solution that will not work. It will lead to failure more often than success. So, point one, an evaluation should include a history. It should be a long and detailed history, and you should have the chance to tell your story, to tell of your other injuries, to really share who you are, what you value, how you got where you are, and where you want to go. And your PT should hear you and understand you, and you should hear their philosophy and understand them, and you guys should come to an agreement that you want to move forward on the same trajectory with using the same tools. The next part is a movement assessment. So a movement assessment is, I'll just take my case. I will take you through a 5-minute full body movement assessment, and we can do this on a camera just as easily as we can do this in person. I just want to see you move all your primary joints in the primary ranges of motion. Look up, look down, look up, look side to side, reach up. You can see how that can easily be done on a video as well as in person. And it's helpful because if I see you try to bend down and you can't move your back at all, we may find your back pain is causing you knee pain. So most of that probably came out in the history, but then we can confirm kind of our hypothesis about what's going wrong with a little bit of movement assessment. A quick 5-minute screening will tell us a lot. What How we'll actually learn more is by going through the process, by getting started. So we do the history, we do this quick screening, we prescribe some starting points, and we start to build progressions, and we find your holding and your sticking points. And as we do that, we should find the joints that aren't moving well enough, the nervous system that's causing pain and flare ups, the weak areas of your body, the right shoulder that just can't activate in this range of motion, just has no power. We will start to find those things as we progress. And that doesn't mean we've wasted our time. That means we've done the most accurate way of finding out. Because if I just take you through a 1 hour movement assessment, and you can go pay for these, they're really cool. Like, oh, I'm going to go to the university and get this super biomechanic expert movement assessment. Maybe that's helpful, maybe it's not. It's super interesting. Like, I'm intrigued by it, but what I know at the end of the day is it won't tell me anything more that will help me guide this process than the history and a quick basic movement assessment will, and then getting started and adjusting over time, because you will move differently over time under load in different circumstances than you will at some big fancy biomechanics assessment. So nothing wrong with that experience. That's cool. You may come away with some knowledge, but the reality is, whether it's performance or rehab to get out of pain, the best thing is to understand your starting point in a very basic manner and then build from there. And you'll learn to understand your body better and better, as will I or your practitioner, as we prescribe different movements, different exercises, different training sessions. They will reveal your weak points. They will reveal where your nervous system is going haywire and telling you that the knee doesn't work. So I hope that makes sense. That's a quick and easy screen. Everybody's going to have a little bit different technique. It could be as simple as a Turkish get up. I've used a Turkish get up as a movement assessment. It can reveal a lot. It can be, I've used something like a SFMA where we just go through top tier. If you don't know what that means, that's fine. You don't need to Google it. But it just, what you want to do is be taken through a full body assessment. Also, if I come in and my elbow hurts and my PT doesn't look at how my neck moves and how my shoulder moves and my wrist and my back, then any movement assessment we did just on the elbow is it's very low value. It really doesn't tell us what we need to know. Everything is connected. We learned that when we were little kids, right? Thigh bone connected to my knee bone, etc. That's true. It's a chain reaction. It starts from the bottom up, most likely, but it is all connected. So we need to take a holistic global picture of all of our injuries and then build out from there. The final portion is this special test segment. So when you go to PT school and get your doctorate, you learn all these special tests. And, you know, if you've ever torn your ACL and the trainer came out and jerked on your knee and find out, oh, it moves, you've got a torn ACL, or a meniscus, you can stand on one leg and twist and you find out there's a meniscus tear. So they can tell us some things. What we've found is most of these special tests actually are not the most accurate. They may be false positives and false negatives, meaning they may test positive, and so I label you with the diagnosis, but then that test wasn't actually accurate. There was something else causing the pain or the movement that we got a positive result from on this test. So they're not the most accurate. Basically, all of them are inaccurate and unreliable. So that alone makes them not valuable or that valuable. Also, what we know is if we've gotten a proper history and we've done a bit of a movement screen and we have a clear goal and we get started, our treatment plan won't look any different, even if the special test is accurate and useful. Even if I suspect you have a torn meniscus in your knee, the history makes it sound like it. The movement assessment also makes us see some holdups there that would lead me to further confirm my diagnosis. And one of these special tests that is fairly useful is a meniscus test. So I use that special test on you, and I take you through and say, "Yep, now I'm 100% certain you have a meniscal tear." Okay, that's nice, and it's helpful to know. So patients like to know what's wrong. Fair, we all like to know what's wrong so we can solve it. But at the end of the day, that special test was a waste of time, in the sense that I already was 90% certain or 95% certain, and my treatment didn't change at all. So the point being is, in an evaluation, maybe we do some special tests, maybe we don't. If you're in a clinic, your PT is probably going to take you through a whole slew of special tests. If it's virtual, some of those are still doable via video call. Some of them are a little more difficult because they require hands-on. But the point being is, they probably aren't the most important or even really a needed part of the evaluation. What is absolutely needed is the history. Secondarily, a bit of a movement screen would be useful. And then you need to understand at the end of that session. So this would be the third most valuable part of that session in my mind. You need to understand a prognosis. And a prognosis is just, can you give me an idea of, can I get better? How long will it take to get better? What's it going to take to get better? And can I run my race next month? Can I play with my grandkids when I go visit them in the spring? You need your PT should have the skills and understanding at the end of that session to give you a prognosis. And you should understand, because they should explain to you, that that prognosis is not set in stone. There may be setbacks. We may find you don't heal as fast as we expected or as fast as is typical. Or you may heal really fast. You may tolerate rehab really well. We may be able to up the volume faster. But the prognosis should be a part of that conversation. You should leave that evaluation saying, "Oh, Dr. Freeborn said I have a meniscus tear. The surgeon told me I should get surgery. He's saying he can rehab it by following his program and education. He's saying over the next 3 to 6 months, we'll hit these milestones and I will be able to run a marathon still, because that's my real big goal in life. I want to run that marathon." He's saying I don't need the surgery. Now I have a choice to make. Do I believe the physical therapist with this plan? Do I believe the surgeon? Which one fits my lifestyle better? You should leave that conversation with a choice to make, or if you're all in on physical therapy, with an understanding of the plan that I have for you, or whoever you're seeing, a plan that, and where we expect that plan to take you to, and what the top outcome is. I mean, if you have a knee pain, since we're on knee pain, if you have a knee problem and you only want to be able to walk your dog, I say only, everybody's got their goals and everybody's got their level of functions. But if your goal is to be able to walk your dog around the block every morning, that's a different dream outcome than the patient who comes to me and says, "I signed up for my first Ironman in August and it's going to take me 14 hours and my knee hurts and I can't train." Or the through hikers who call me and say, "I've got a 2,000-mile through hike. It's going to take me 6 months. My knee hurts today and I'm planning to start next week. Can I do that? Or do I have to delay a year? And if I delay a year, can I do that?" These are real questions, real conversations, and these should take place in that evaluation, because you should leave there understanding that Dr. Freeborn said I can do the through hike. My knee will be fine. We'll even rehab it as we're going. Or he said he thinks if I do it, I won't be able to finish. I'll get worse and worse. I'm able to try it because I won't cause long-term damage, but the pain will likely be so great that I'll have to come out and start over. Now I'm willing to take that risk. Or I'm willing to go, I've been training for this marathon for the Olympic trials. I know I've got a qualifying time in. I know I've got a Boston qualifier in me. My fitness is there. My knee hurts. He said, I can give it a go. If I can suck it up and get through the pain and finish the race, I can probably achieve my goal. Worst case scenario, the pain flares up. We set ourselves back a couple weeks and we have to build from there. But it's worth the risk because I'm not going to cause permanent damage. All of those things are things that should come up in a physical therapy evaluation. If they're not, either your PT is doing a bad job. That's the primary point, because we should be able to pull those questions out of you, and you may not be asking the questions. This is all about you. It should be all about you, not me, not my goal, not my next patient. It's really about, what do you need, what's your problem, where are you trying to get to, and can I solve it, and how can I solve it? What does that look like? Should we work together? Do our values mesh? Dr. Freeborn wants me to go find a weight room and swing a kettlebell and do heavy squats, but all I want to do is run a marathon. I'm not going to listen to him. Cool, don't sign up with me. Go find someone else that can help you, or go try something else. And if it doesn't work, come back to me. Let's make sure our values are the same, our vision is the same, and let's make sure there's a clear plan when you finish that PT evaluation. I hope that clarifies what a good PT evaluation should look like. Feel free to schedule one with me below. The link's below. You can jump on a call. We can go through this whole process. You can have the experience, and you can decide if I'm the person to help you or if someone else is the person to help you. But remember that your health and wellness is your responsibility, not mine. I'm here to help. If you hire me, then we'll work together and we'll take that journey together. But it's your responsibility to assess the care you're being provided, to assess that evaluation and say, this guy didn't ask me, or this gal didn't ask me any of the right questions. I don't feel confident. This isn't the plan I wanted. I don't want surgery. I know the surgeon said this is what he saw in the MRI, but I wonder if there's a better plan. Then it's your responsibility to make that choice and choose the best provider you can find. That's the freedom you have in our healthcare system. We've got a healthcare system that's not working well for most people. But some of that is on us taking our own responsibility and saying no to the doctor, no to the surgeon, no to the PT, no to the chiropractor, and saying, this is what I want, and searching until you find someone whose values mesh with what you want, who understands your problem, who takes the time to hear your story and learn where you want to go, and then who confidently says, I know how to get there. Let's take this journey together. I hope that's helpful. Reach out if you have any questions. Please subscribe to my channel. I'm going to provide as much content and free education as I can to help folks like you understand how to take this rehab and performance journey in a better, more effective manner. So subscribe to my channel to get the notifications, to get the updates. Comment on the videos. I'll get back to you and comment back. Feel free to reach out or schedule an evaluation with me if you're needing help with your rehab or performance goals. We get people out of pain, and we help people reach their top level physical and activity goals, from professional triathletes and CrossFitters to 80-year-old grandmas who just want to play with their grandkids a little bit longer. So hope that helps. Be strong.